This is part one of a four-part series on technical assistance for success to provide a high-level overview of becoming a CDC-recognized deliverer of the National Diabetes Prevention Program Lifestyle Change Program. This segment will discuss the Organizational Capacity Assessment. Understanding the DPRP. CDC's Diabetes Prevention Recognition Program, also known as the DPRP, is the quality assurance arm of the National Diabetes Prevention Program. The DPRP identifies organizations that have demonstrated their ability to deliver successful, evidence-based lifestyle change programs that help people prevent or delay type 2 diabetes. Organizations that want to be CDC recognized are strongly encouraged to complete the Organizational Capacity Assessment. The assessment will reveal whether your organization has the necessary knowledge and resources to receive CDC recognition for successfully delivering the National DPP Lifestyle Change Program, and will identify any areas you may need to enhance before you apply. Meeting the DPRP standards. To become CDC recognized, an organization must meet the DPRP standards and operating procedures, the evidence-based requirements by which all programs are evaluated for CDC recognition. Fulfilling the DPRP standards includes having the right staff, understanding their roles, making sure you can sustain the lifestyle change program long-term, and knowing the requirements associated with each of the 4 different delivery modes: in-person, online, distance learning, or combination. Your organization must also have the ability to recruit, enroll, and retain participants to sustain the program. Selecting a delivery mode. For in-person only programs, participants are physically present in a classroom or classroom-like setting that has a private area for weighing and monitoring participants. Sessions are led by trained lifestyle coaches. Online year-long lifestyle change programs, on the other hand, are always delivered online. Participants log into course sessions with computers, tablets, or smartphones. Lifestyle coaches track their progress through the course. Distance learning is delivered via remote classroom or telehealth with live delivery of session content by the lifestyle coach. And combination programs are delivered as combinations of in-person, online, or distance learning sessions for the same group of participants. Live interaction by lifestyle coaches is a requirement of all delivery modes and should be offered to each participant no less than once per week during the first 6 months and once per month during the second 6 months. Emails and text messages can count toward the requirement for live coach interaction as long as there is bidirectional communication. That is, organizations do not simply send out an announcement via text or email and count that as live coach interaction. The participant must have the ability to respond to and get support from the lifestyle change coach. Conducting makeup sessions. All organizations may offer makeup sessions to participants who miss a scheduled session. Makeup sessions can be provided in any of the previously mentioned delivery modes and are analyzed in the same way as regularly scheduled sessions. Therefore, makeup sessions must be comparable to regularly scheduled sessions in content and length. The makeup session is used to review a CDC-approved curriculum module, which is generally about an hour. Understanding program staffing requirements. Once you've identified the delivery mode for your participants, in-person, online, distance learning, or combination, you need to determine how many staff members are necessary and if they'll work full or part-time. Delivering a 1-hour session requires 3 to 5 hours of staff time, depending on the setup of the class and the time it takes for email or text reminders and data documentation and reporting. The number of lifestyle coaches you need to hire and their time allocations will vary depending on the delivery mode used and, more importantly, how many classes they're teaching. Reviewing roles and responsibilities for staff. As for your staff, there are 3 key roles you need to fill: lifestyle coaches, program coordinators, and data preparers. Lifestyle coaches use a CDC-approved curriculum and provide support and guidance for program participants. Along with motivating participants, they make learning an interactive, shared, and fun experience. They also lead the makeup sessions and work with the program coordinator and, if a separate person is in this role, the data preparer. And while lifestyle coaches are sometimes health professionals, they do not have to be. Lay health workers, such as community health workers or promoters, may also serve in this role. Program coordinators serve as institutional experts who implement the lifestyle change program consistent with the DPRP standards. They supervise daily program operations, guide and support lifestyle coaches toward quality outcomes, and share information from CDC. They also help with program data submissions, help monitor data, and engage in other key functions such as publicity and marketing. The third required role is a data preparer who gathers, reviews, and submits data to CDC. Depending on your organization's size and resources, this role might be held by a different individual or by the lifestyle coach. Proper staffing for each role is critical to ensure your organization delivers a quality lifestyle change program with fidelity to the evidence-based DPRP standards. Reviewing training requirements. All lifestyle coaches must be trained to the specific curriculum being used by the recognized organization before offering their first class. The recommended minimum length of formal training for new lifestyle coaches is at least 12 hours or 2 days. This can be done in one of 4 ways. 1, by a training entity listed on the CDC website. 2, by a private organization with a national network of CDC-recognized program sites. 3, by a CDC-recognized virtual organization with national reach. Or 4, by a master trainer who has completed at least 12 hours of formal training as a lifestyle coach, has completed a master training program offered by a training entity listed on the National DPP Customer Service Center, and has delivered the lifestyle change program for at least 1 year. Because program evaluation findings have demonstrated that well-trained and highly motivated lifestyle coaches have a positive impact on participant outcomes, all lifestyle coaches must complete at least 2 hours of advanced coach training each year by an approved training entity. Advanced coach training builds on the foundational skills necessary for helping participants make effective change. Lifestyle coaches are also encouraged to be trained on group facilitation, motivational interviewing, data collection, and strategies for addressing social determinants of health. Additional continuing training is encouraged, including CDC-sponsored webinar trainings on specialized topics such as program delivery and data submission. Since program coordinators are responsible for overall program implementation, they should also complete both formal training and annual advanced coach training, just as lifestyle coaches do. This is because of the important role the program coordinator plays in hiring, mentoring, and supervising lifestyle coaches, and, if necessary, acting as a backup coach. You'll find links to various training entity profiles with details on their offerings by referencing the Training for Your Lifestyle Coaches resource on the National DPP Customer Service Center. Because program coordinators are responsible for hiring, guiding, and supervising lifestyle coaches, having at least 1 year's experience working as a lifestyle coach is highly recommended. For a complete description of the exact skills and knowledge the lifestyle coaches and program coordinators need, along with their responsibilities, see the current DPRP standards. Estimating program cost. While CDC estimates the program delivery cost per participant at about $500 for the year, this cost varies depending on things like the organization's funding and resources, ability to get private or public insurance reimbursement by working with partners, and whether the program is offered at a worksite as part of an employee benefits package. Organizations with additional funding sources may cover some of the program costs, while Others may ask participants to pay a small fee. Taking next steps. You should thoroughly read the DPRP standards before filling the capacity assessment, which you'll find included in the current DPRP standards. After you complete the assessment, total the number of yes, no, unsure, and NA answers. If you responded with yes to the majority of questions, if your answers are mostly yes, you're ready to apply for CDC recognition. However, you would benefit from improving any areas where you marked no or unsure, as all are important for successfully delivering the program. You can apply for CDC recognition on the CDC website. If you have any questions about applying, please reach out by visiting the Customer Service Center at nationaldppcsc.cdc.gov and submitting a technical assistance request. To submit a request, you will need to complete a brief profile by selecting Login and then Register. Once logged in, select Contact Us, Contact Support on the homepage. If you responded with no to the majority of questions. If no and unsure responses outnumber the yes ones, you may want to apply at a later date. And think about partnering with another CDC-recognized organization in your community, working with your organization's leadership to enhance your capabilities, or contacting CDC's DPRP for technical assistance. Thank you. And remember, CDC is always available to help guide and support you.